question. Right, so if you have read and understood considering its surgical and administration, kindly tell me, what are you looking at?
This is a gross specimen of heart.
Yes.
And B is auricle of right atrium.
Kindly begin with A.
Yes, ma'am. A is aorta.
Yes.
Ascending aorta. B
Yes.
is auricle of right atrium.
Yes.
C is crista terminalis. D is tricuspid valve. H is cusp of tricuspid. D is cusp of tricuspid valve. H is chorditendine and papillary muscle. E is auricle of infundibulum of pulmonary trunk. F is auricle of left atrium, and
Yes.
G is left anterior descending artery.
Okay. Which is the branch of?
It's a branch of left coronary artery.
And left coronary artery arises from where?
It arises from left posterior sinus of ascending aorta.
Okay. All right. Can you also please tell me if you can identify these structures? 7, please.
7 is infundibulum of pulmonary trunk. 9 is pulmonary trunk.
Okay. 9 is pulmonary trunk. What is 1, please? 1?
It's a cusp of tricuspid valve.
Okay. And 5, please?
Chorditendine.
All right. And chorditendine. How many chorditendines are there? How many papillary muscles are there which are attached to? What is 2? What is 2? Can you see 2 here?
Yes, ma'am. 2 is papillary muscles.
Yes. So how many are there normally present?
3 to 5, ma'am. Present.
All right. If you can please identify 18 over here. It's 18.
It's auricle of right atrium.
Okay. What is the significance of auricle of the left, right auricle? Yes. Yes. What is secreted by the right auricle?
Sorry, ma'am.
Okay, you'll tell me later, please. All right. Can you please identify 25 over here?
That is superior vena cava.
Very good. And then if you can please identify 17 over here.
It's infundibulum of pulmonary trunk.
Yes. And then if you can please identify which number is it?
This is right ventricle.
Yeah. And then if you can identify the 3 over here. What have you already told me?
So it's ascending aorta.
Yes, ascending aorta. And then there is another one, 22 over here. I think there it is 3 with, no, 22. And 5,
so
and then,
right.
yes, okay. Can you please tell me what is the function of chorda canine that we identified over here?
Yes, during ventricular contraction, papillary muscle contract and they make chordae tendineae tight or tense so that the valves shut. Mitral and tricuspid valves, they
Yes.
shut so that there is no backflow of the blood from ventricle to atrium.
Okay. Can you please tell me how many branches there are of ascending aorta?
There are 2 branches, ma'am, right and left coronary.
Okay. Can you tell me the course of the right coronary artery, please?
Yes, right coronary artery arises from the sinus of ascending aorta on the anterior side, near anterior cusp.
Then?
And it travels. It
Yes.
travels through the atrioventricular groove or sulcus.
Yes.
And it gives off a marginal branch anteriorly. Then it goes posteriorly and descends. Also SA node that is called SA nodal branch, and then posteriorly it will give posterior interventricular septal branch, which supplies posterior 1/3 of interventricular septum. It's called posterior descending artery.
Yes. What is the normal variation that one can find? That is with
usually the posterior the vessels
right coronary artery and the left coronary
posterior
artery.
Interventricular vessel.
Yes. Yes. Yes, they can be equal. Like
there can be left
in 10% cases.
Dominance or.
Can you please tell me the innervation of SA node and AV node?
Yes,
or
60% of the patients SA node is okay. Inner way, SA node is supplied sympathetic and parasympathetic. Sympathetic is from sympathetic plexus, cardiac plexus, and parasympathetic is from vagus.
Yes. What about the arterial supply of the SA node and the AV node? Which vessel supplies them?
60% of the time SA node is supplied by branch of right coronary artery, and 80% of the times AV node is supplied by branch of right coronary artery. Only in 40 and 80% of
please tell
the
me
patients
about,
it is supplied by left coronary artery.
Can you please tell me about the coronary sinus? What is it and where is it located? Coronary sinus
is located in atrioventricular sulcus posteriorly, and it receives blood supply from cardiac veins, and it opens into the right atrium at the junction of inferior vena cava and AV valve.
Okay. Yes. Can you tell me how many coronary veins they drain in it? How many coronary veins there are? And yes.
Great, middle, and small cardiac veins are there. Also, sometimes oblique vein.
Yes. All right. Can you please tell me? Bell is gone, but then I wasn't done with the questions. Can you tell me where pulmonary valve is located? Please.
Sorry, ma'am. Can you please repeat the question?
Pulmonary valve. Can you tell me the location of the pulmonary valve? It is located whereabout? Yes.
It lies at level of T6 vertebra.
Yes. And?
Pulmonary trunk lies at the level of T5 vertebra.
Yes. But then how many cusps it has, and it divides,
has 3 cusps.
Yes. Where is it located? I mean, between. I wanted to know.
It is
because they can ask you to identify it. So, or they'll point it out and you'll have to identify. So you should know, is it located on the right side or the left side of the heart, and it's dividing between the ventricle and the atrium, or this is what I want to know. And when you are telling me the location, left second intercostal space, parasternal edge, on the left parasternal edge. You said how many cusps it has?
Yes,
3.
3 cusps. Yes.
Okay, good. Right. I maybe have something more. I don't know. Yes, please. If you can describe the image that you're looking at, taken from another book, but
it is again a gross specimen of heart.
Yes,
and it is showing first is the right atrium, 2 is right ventricle, 3 is left ventricle, and 4 is auricle of left ventricle, 5th is ascending aorta, and 7, 8, 9 branches of ascending aorta, 6th is SVC.
Yes. Can you please tell me the development of the heart? How is it developed?
Yes, ma'am. Heart is developed in primitive mesoderm by 2 endothelial tubes which fuse, and there is segmentation. Proximal, there is ventricular part, atrial part, bulbus cordis, and truncus arteriosus and sinus venosus. Then during development in a closed pericardial space, the tubes twist and turn to form S-shaped cavity, and it gives derivatives to various parts of heart. Bulbus cordis forms the proximal part. In its proximal part gives rise to atrium. The ventricular part gives rise to left ventricle.
And truncus arteriosus,
it gives rise to aorta and pulmonary arteries. And sinus venosus gives rise to superior vena cava and pulmonary.
Can you please tell me how many layers of pericardium there are?
There are 3 layers of pericardium: outer fibrous and parietal and visceral layer of serous pericardium.
Okay, can you tell me where is the pericardial space and what does it normally contains? Where is it located? What
pericardial space is located between visceral and parietal layer of serous pericardium, and it contains serous fluid.
Okay, if you will be doing pericardiocentesis, this is my last question. Okay, so once you're inserting needle from skin inward, what are the layers that will come across?
Yes, ma'am. In subxiphoid approach, in emergency pericardiocentesis, there would be skin, deep superficial fascia, deep fascia.
At what level would you be doing it?
Just at the just subcostal level or at xiphoid level, just below xiphoid process, at T9 process. Skin, superficial fascia, deep fascia.
Yes.
Anterior rectus sheath, the rectus abdominis, posterior rectus sheath. Then diaphragm and endothoracic fascia, and then fibrous and parietal layer of pericardium.
All right, good. Thank you. This is my last question. Right. What are the structures that can get that are at risk of getting injured? I'm sorry, I'm doing fraud. I said last question, but then it came in my mind.
Oh, no, ma'am. In the cases of subxiphoid pericardiocentesis, diaphragm, liver, and stomach can get injured. And in cases of parasternal pericardiocentesis, lungs can be injured, leading pneumothorax. And in case of both, there might be injury to coronary
Heart,
circulation,
yeah.
coronary arteries and heart.
Very good. Superb. How much pericardial fluid is normally present? Do you have any idea? 50 ml. So, right. You told me everything good. 50. Okay, right. You told me, and you told me the structures. Very good. Okay, good. I am satisfied and happy. So, thanks. So, I have started.